Julian Stanley is the Chief Executive Officer at Healthwatch Cambridgeshire and Peterborough. They represent patients across the county. Julian, good morning.
Good morning, Dottie.
Is this an issue that's been brought to you before at Healthwatch?
Yes, it is an issue that has been reported to us by many people before, and we've done a number of pieces of work in the last couple of years on trying to summarise some of the problems that occur, and they've been referred to in your pieces this morning. And it's tragic, of course, when anybody has to be left waiting. And I think there is an acknowledgement across the country and in Cambridgeshire that there are problems around the transition period. So the way our services are structured mean that young people get one service and then you move into adulthood. And we all know that that transition at the best of times is complicated for young people themselves and for parents, and it's further complicated if waiting lists are longer in one place than another, and then you get this problem of people falling through gaps, and it's really important that we hear from people about not only where it's worked, but also particularly where it hasn't worked for them, so that we can replay that information, listen and report back to those planning our services in the area.
It sounds like there is an acknowledgement, as you say, that this is an issue and that there is, I'm sure, a commitment to improving it. But how quickly can that happen? Because, and not to put too fine a point on it, but lives are at stake with something like this.
Yes, absolutely. I mean, that is true. There is a definite commitment across the services to actually make change happen. And we all know that those things tend to go more slowly than anybody would like. It's difficult to pinpoint exactly why, but I do know that there's a strong commitment to making change. I think it's really important. One of your contributors this morning talked about the fact that we're all more aware about mental health and so on. And that's a really positive thing. But I think one of the difficulties for many people is knowing where to turn and what to do, and what signs to recognise and how to get the right help at the right time. It's certainly the case that if people are struggling, it's important that they take action and don't wait. And persistence is all. Certainly in a mental health crisis, it's really important people call 111 and use the option that's available for the first response service. So if you know somebody is experiencing something at the moment that's looking distressing and seems overwhelming, that's really important to take action swiftly. At Healthwatch, we offer some signpost and guidance service information services, and therefore they can contact us if they're struggling, if anyone's struggling, and we can try and point them in the right direction and see if we can help move things along. We can't guarantee that, but we certainly do try to do that for people. And so I think it's really important that people continue to make every effort to get what they need. And in the meantime, what we hope is that people will contact us, give us their stories, and that we'll go back, because the more we're able to play these things back, the more it keeps it high on the agenda.
It's very difficult, isn't it? Because what you're saying in summary, Julian, is to make this better, you need to be the squeaky wheel. But when you're going through mental health difficulties, and especially if you're going through mental health crisis, you don't have the energy, you don't have the capacity to do that, do you?
Absolutely. I mean, dealing with anxiety, uncertainty and worse is very stressful, not only for young people, the people concerned, but also for their carers, for families. It's a very stressful business trying to kind of manage that. And I think it's not that clinicians and service providers aren't aware of that. They are aware of that. I think what happens is the waiting lists are still long. Some of them have come down, but they're still long periods. And knowing who to contact and for what is really important in this process. And I think continuing to improve the communication about where you can get access and how long you may have to wait and what else you can do in the meantime is really important. We have got some very good local services in this area, and there are also some very good websites available. We list those on the Healthwatch website, so we'd encourage people to look at our website, contact organisations like Lifeline, Rethink, Centre 33, the Sun Network. There are many organisations who can assist and try and get people the information and also the services and access to the services that they need. But there's no doubt that the waiting lists are still long, and it's not an ideal situation, one that needs continual work to address.
Yeah, well, your candour on that is appreciated, Julian. Thank you very much. Julian Stanley, CEO of Healthwatch Cambridgeshire and Peterborough, another organisation that you can contact if you need help with mental health services or indeed any health services